Hello, my name is Tai Young, and the article I chose was Cigarette Smoking in the United States from 2006 to 2008 and 2009 to 2010. According to the National Center for Chronic Disease and Prevention and Health Promotion, the leading cause of preventable disease and death in the United States is cigarette smoking. Over 443,000 people lose their lives per year, and it costs about $193 billion in direct healthcare expenditures and productivity losses per year. Declines in smoking prevalence would significantly impact the healthcare system and decrease economic loss due to illnesses and individual productivity loss due to smoke-related diseases. From previous reports, there has been some success in reducing the disparity in cigarette smoking among certain racial and ethnic groups. However, little to no progress was made in reducing the disparity in cigarette smoking among persons of low socioeconomic status and low educational attainment. The survey was conducted over 42,500 participants from 2006 to 2008 and over 27,500 participants from 2009 to 2010. So here are some of the statistics. Some progress is made in reducing cigarette smoking amongst certain racial and ethnic groups. However, this disparity exists amongst the low socioeconomic status. For both youth and adults, little to no change in smoking prevalence was for those below the federal poverty level. However, there was a decrease observed for the youth and adults who were above the federal poverty level. And to give you an idea of the federal poverty level, somebody in 2006 could make an average of $9,800 per year. And in 2010, it increased to $10,800 per year. For people that live in a four-person home, that was a little over $20,000. During 2009 to 2010, the prevalence of smoking was 46.4% amongst 12th graders who dropped out of high school. And for those who continue to smoke throughout their senior year of high school, it was about 21.9%. We can also say for those who dropped out of high school had a chance of about 34.6% chance of smoking. And then for those who got a college degree was about 13.2. So we conclude for our educational attainment, for those who actually dropped out of high school during their senior year had a 50% likely more chance to smoke. For racial and ethnic groups, the lowest people to smoke were amongst Asian and blacks, and the highest was Native Americans. Now, some of the programs and campaigns that we've come across have significantly improved the reach of smoking and have decreased amongst the youth. Particularly truth campaigns, television commercials, and new regulations such as not allowing you to smoke within 50 feet of the building. These are also very great campaigns that have done a lot of great work to decrease the number of smokers and to kind of make it harder to smoke, but it hasn't decreased the access. Some of the things that I'd like to see later on, such a thing they've done in Europe, is to decrease the amount of smoking people are allowed to do in cars with their children. Particularly, we can see that smoking is directly related to asthma-related incidents, to include upper respiratory infections and other things related with children. So these are some of the campaigns that I would like to see going forward. As a child of two people that smoked in a house consistently, I completely understand, and I would seriously like something else to continue with a campaign of decreasing smoking. I'm Tai Young. Thank you for watching, and I'm hoping that you enjoy my discussion. Have a great day.